Hello.
Hey, how are you?
Nice to
meet
meet you.
Nice to meet you as
Nice
well.
to meet you.
Yeah.
All right, so could you guys please introduce yourselves and give me a general overview of what One Network is and why it was founded and what you do in One Network?
Sure.
So, I'm Courtney Latimer. I'm the manager of the One Network, program manager of the One Network. So I have day-to-day oversight over the structure and function of programming, the team, some administrative responsibilities and things like that. Just try to make sure everything's running smooth on a daily basis.
And what do you do?
Yes, my name is Dr. Kimberly Dawn Wisdom, and I serve at Henry Ford Health as Senior Vice President of Community Health and Equity and the Chief Wellness and Diversity Officer. So I have the honor, literally, to lead the WIN Network, Women Inspired Neighborhood Network Detroit. We're expanding, so there's a WIN Network Cleveland.
Okay.
But just to lead and guide a team that is so overly committed, work tirelessly, work very, very hard to address the needs of women, and think of even more and more innovative ways to do that. And so whether it's a mural project that you see on the wall, maybe you can capture that,
Yeah.
you know, which is just, there's a whole really cool story behind that, or identifying ways to want to reach out more and more to women that aren't pregnant even, and we did a lot of that pre-COVID, as well as moms that are pregnant, and connecting them with a community health worker, with a certified nurse midwife, and that sort of thing. So I can describe more of the nuts and bolts of the project too.
Yeah, so why was One Network founded?
Well, it's an interesting story. I'll try to give you the truncated version. But there were 4 CEOs that were CEOs, chief executive officers of Detroit-based hospitals, and there was a need to address infant mortality. And I was returning from serving as Surgeon General for the state of Michigan with Governor Granholm, so I had the honor of working across the entire state. And infant mortality was one of my babies, so to speak, in terms of addressing that in 11 very underserved counties. And so when coming back to Henry Ford, they knew of my interest, and they knew that I couldn't be confined to one hospital or one building or one health system, that, you know, after serving at the state level, you kind of feel like you want to address more than one small entity. So they thought it was great to charge me under the leadership of Nancy Schlichting, our then CEO, to ask me to, can you address infant mortality for our region? So here you have 4 competing hospitals coming together and saying, you know, Wisdom, would you address infant mortality across our region? And I was elated, because I wanted to work beyond the walls of one health system.
Yeah.
I wanted to really have a team that we could be transformative across a much larger footprint region.
Well, that's even gives me a little bit of hope that hospitals would even ask you to do that, because sometimes you question if hospitals are just really for-profit organizations, or if they even really care about the things that are going on with the health of communities and just where our world is in general. And this is a lot about you, that they even thought to ask you to address that. So.
Well, they, I think, were pretty forward-thinking leaders, whether it was Nancy Schlichting or her predecessor, Gail Warden, and then actually the other CEOs at the table. One of them, actually, he was Mike Duggan. He was CEO of DMC at the time. So these are forward-thinking leaders that recognize that I was also oriented toward the community in a very significant way. So it was really sort of this beautiful alignment where they wanted to see something move, and I definitely wanted to participate and lead the effort. So we established a Detroit Regional Infant Mortality Reduction Task Force. And usually task forces are groups of people that kind of meet, have a task, and are done. Well, it was clear to us that our task was going to be lifelong. I mean, we weren't going to just sort of deal with something and then, okay, we're done, we button that up. So we brought these 4 competing health systems together, community partners, community-based organizations, and academia, and sat at the table and started thinking about how can we collectively drive down infant mortality.
Yeah, this video is about maternal mortality, but I think infant mortality and maternal mortality go hand in hand, because obviously children are very important to mothers. I've been told it's a special kind of love. I don't have a baby, but that's what I've been told. And of course, mothers are very important to the health and well-being of children. Can you talk a little bit about what you've seen specifically in the Black community as it relates to your work in infant mortality, and why you did it in Detroit? Because I know you said several counties at the time were having issues with infant mortality, and talk about that a little bit.
So Detroit had one of the highest infant mortality rates in the state and in the country, and that infant mortality rate had been high for quite some time, and many people had done really great work, Vern Davis Anthony, others, to try to drive it down, but then it would creep back up after that intervention was over. So we felt as though if we could design something, and this is where Courtney and Jay and the team was really involved, and our community health workers in being really innovative in this space, but if we could design something that would if it could work well in Detroit, it could work well anywhere. Because, just watch the news or any, challenges that happen. They're like, well, here's Detroit, here's, here are the statistics about it. It's like, why are you looking at Detroit? I mean, so we do have our challenges, but the beauty of it is that if it works well, which it has in a city like Detroit, it could work in Atlanta, it could work in Philadelphia, it could work in Cleveland, it could work in, many other, Atlanta, many other cities that are very similar in terms of the urban dynamic. It could work in Detroit. If it plays well in Detroit, it could play well anywhere, right?
Yeah, that's really cool. I saw on your website that it said, I believe 30% of Black and Hispanic women feel like they were treated poorly by their healthcare provider because of a difference in opinion they had with the provider about their labor and their pregnancy. Why do you think that Black women specifically are having this issue, and what do you think the root of the issue is?
Well, Courtney, you want to start to address that? Because she is the one that's working really, really closely with, and hearing what the women are saying, our women in our program.
Yeah, I think one of the reasons that that women of color are receiving this type of treatment or having these experiences just comes down to lack of respectful care. We talk about a lot. We at Henry Ford, we provide unconscious bias training called Ruby, reducing unconscious bias and initiative training to our women's health team, as well as other physician partners throughout the state of Michigan. And the purpose is to teach providers about the importance of listening to your patients and the importance of respectful care. Whereas if this patient is telling you that this is what's going on with their body, trust that they know what's going on with their own body, and let's figure out how we can get these things handled together, and not just assume that because you are the provider that you know best, that you want better for this patient than what they want for themselves and their babies. And so I really think it boils down to a lack of that type of training previously. I think in the past there wasn't a big focus on why it's important to respect your patients, especially a woman who's bringing life into the world, why it's so important to listen to what they're saying and to be a little more empathetic, as opposed to always being in work mode. I think it's important to put yourselves in the shoes of your patients as a provider sometimes. When you have patients that are having challenges or barriers, if this patient can't come to the doctor, it's not necessarily because she doesn't want to. It's because sometimes she can't. Maybe she doesn't have transportation or a babysitter or whatever. So extremely important, and I think that's why that experience has been the way it is, because of the lack of focus on things outside of the procedural portion of being a clinician. There's a human you're dealing with a whole person, not just a patient. And so we try our hardest here at Henry Ford to make sure that our clinicians in women's health are properly trained and have that focus on respectful care, to make sure that our women receive amazing patient care. And in One Network, we have a specific focus on choosing the physicians and the clinicians that we work with and the midwives that we work with based on their passion and their ability to, properly care for and respect our patients. So, like I was talking to you about earlier, it's sometimes difficult to navigate the resources in the Metro Detroit area because there's so many. It's so fragmented that a mother can get or family can get very stressed out and feel defeated trying to navigate all those things. So here at One Network, our community health workers serve as the resource for the resources, if I can say it that way. You give a mom a CHW, the CHW talks to her about what she needs, what she desires, what her family needs, and then they work hard to try to mitigate as many barriers as they can for that mom so that she can bring a healthy baby into this world and raise a healthy baby.
So I was just going to say, even the dynamic too between the community health worker, who's just sort of that secret sauce, and the certified nurse midwives who bring that clinical perspective, the two combined in the group visit model just is a combination that's just been yielded wonderful results and has been very successful from a data standpoint, and also, women have referred their sisters, their other friends to the program, and nothing better than a referral in terms of speaking of the impact that you're having on that person's life. If they want to refer and they trust you enough to refer their family members, their friends to you, that's a real testament to the work that the team has been involved in.
It is, because we all know places that we definitely won't refer.
Yeah.
I mean, you even go to a restaurant and you're like, don't ever go there. Like, so the details matter, is what I'm trying to say. And it seems like you guys really care about the details. Now, you talked about group prenatal care. Could you tell me a little bit more about what that is and why that's even important?
Sure. Core to the work is what we call the centering pregnancy model. So that was one that was developed many years ago by a woman by the name of Sharon Rising. But we have innovated on that model by including the community health workers. So the centering model is where 8 to 12 women will meet together as a group for 2 hours. So the traditional prenatal visit, you might have 5, 10, maybe 15 minutes with your provider, and they're doing all the belly time as well as answering any of your questions. But typically there's not sufficient time to really go in deeply into education or answer the questions even sufficiently. So with this group model, they actually meet for 2 hours at a time for per month for the first several sessions, and then closer to the time of delivery, then those sessions become every 2 weeks, much closer. But for 2 hours, there's belly time, of course, about a half an hour belly time, and then an hour and a half where they sit actually in a circle, and that's why these chairs are designed as they are, because this is actually the space where the women sit. This is the space. So the team actually ordered furniture that would actually fit. You've got to be in a circle. So the facilitators, the certified nurse midwife and the community health worker, both facilitate the session, but all the women sit. It's kind of like King Arthur's Round Table, where yes, expertise comes from the certified nurse midwife and the community health worker, but expertise also comes from around the table or around the room, because some of these women, this is their second, third, fourth pregnancy, they are experts in many respects on how to navigate through a pregnancy well, successfully. So everyone at some level is an expert, and then if there's any misinformation shared, the certified nurse midwife or the community health worker can say, well, let's talk about that a little bit more and maybe adjust some of what they may say, but they get a tremendous amount of information because they learn from each other as well as from the experts.
Yeah, and that helps everybody feel valued. I think that's so important too. And even what you were saying about sort of humanizing patients, and that everybody has something that they can contribute. And I think a lot of times in healthcare, I mean, I've even been taught in school that the patient is the expert on what's going on in their body. That we forget that so many times because education sometimes, I think, we can allow it to pollute our minds and make you think, oh, I know everything because I read one chapter in a textbook, when that's not accurate. So, on your patient website, not your patient website, on your just general website, you have a lot of patient testimonials, a lot of videos about different things in the community. I saw you're specifically connected to Osborne community as well as Brightmoor and just a lot of different things that you do. But is there a reason why you have so many testimonials on your website besides just showing the results of your work?
Well, I'll start off. It's so important that we are very intentional about trying to capture the stories when we can, because some of these stories are very powerful. I think of the April and Ava, you know, the woman that had 3 preterm births, low birth weight babies, and then ultimately her 4th pregnancy, which was with Wynn. She had a full-term baby and didn't realize she could have a full-term baby.
Wow.
So we have to capture these stories because, I mean, sometimes people think it's incredible, like, are we making up this story? Well, it's better hearing it from them. I mean, they are the data, too. We can have all the numbers, but it sort of brings the data to life when these women can tell their own stories and the impact Wynn has had on them. So we try to capture as many as we can. Of course, we're so busy delivering programming. The capturing the stories is another whole endeavor, but if we can have these women tell their own stories, the narrative is powerful. And we know that storytelling is key, whether it's convincing other people to join, whether it's convincing funders to fund the effort, whether it's convincing women to join the program. If they can go on the website and see, oh, this woman looks like me, this could be me, and can relate in that respect, and then say, I want to join because of those testimonials, that's very powerful.
Wow, and I think that's really important, especially what you said, somebody who looks like they come from a similar background. Even I've noticed a lot of times when I'm learning about OB, or I just had my OB rotation, but it's more from the perspective that every woman has a loving husband and they're this great family. They got a golden retriever that's never bit anyone in their lives.
Golden retriever, that's right.
Yeah. And they're coming in here and they're going to have this beautiful pregnancy. When that wasn't my background. Again, I've never given birth. I'm just talking about my home background, and that wasn't most women I know their home background. And sometimes I think when people hear that and learn about that, they can sometimes, if they come from that background, be taken off guard when they meet a woman who doesn't have any support when they get in the room, or a woman who doesn't have a lot of financial resources around her and all of those different things. So I do think it's really important that we humanize those people too and say, okay, sit around the table, they still have something to offer, even if they're coming from the situation, because I'm a big believer that situations don't define who you are.
That's right.
So that's really important. And on the topic of support, I see that you guys have, I believe, Wynn Fatherhood. It says we're in this together, which I love. But could you talk more about why you guys have that and like why you think that's important, instead of just, you know, general support, your friends in the room, but what's the importance of having the guy that got you pregnant in the room?
Yeah, so I can start with that one. I think when we started in 2016, the Centering Pregnancy model calls for the mom and a support person to join group. And so what we noticed as we continued to go throughout the year, 2016, 17, 18, we said, wow, there is an overwhelming amount of fathers attending groups with these moms. Fathers that looked like our fathers, that looked like our brothers. We are like, this is our community coming together to make sure that these babies are being born healthy. And so we wanted to make sure that we had a concerted, focused effort on being inclusive of the fathers, because if they're here, we need to speak to them, because that's the support person. When mom is in labor, when her vision is cloudy, when she can't remember what the provider told her, dad, if he's the one that's here, he's gonna be the one he's gonna be her voice. He's gonna advocate for her. So that's the person that we need to talk to. And we also need to let him know that you're important in this. you are a part of this family dynamic. This doesn't work. If you're here, this doesn't work without you. So let's value Dad. He's here. He showed up. He's not just here though. Our fathers participate. Like when network dads, they participate. They want to tell the provider, they want to tell the midwife, I told her not to eat that. I told her she's not supposed to be drinking that. I tried to tell her. You know, they want to help with breastfeeding. They want to learn how to change diapers. You know, they want to put the diaper bag together. They want to make sure that they are knowledgeable in this baby, especially fathers that are here for having babies for the first time. So we want to be very intentional about making sure that we capitalize on the opportunity to be able to be inclusive and show fathers that it's not just mom having the baby. The family dynamic is extremely important. And we wanted to make sure that anybody who came to Win Network felt like we valued fathers as well.
Yeah.
Exactly. And what's great about what Courtney said is it dispels the myth that there are these dads out there that don't care. You know, there are a lot of dads that want to know how to care for the baby. They want to know how to better care for their significant other. And it takes away that whole piece that they don't care.
Yeah.
They want to learn, they want to know. So by just seeing them show up, it was clear that they wanted to be a part of this baby's life. And I think probably while we haven't measured it scientifically at this point, the bonding, if you could start bonding with that baby even before the baby's born in a very significant way and feeling empowered, like I can do stuff. I can help my, woman who's pregnant now, whether it's your wife or not, but also I can help with feeding. I don't have to be afraid. I can be a key part of the bonding experience and then move forward. Not like the dad that sits over there, we'll call you when the baby's, walking, or 4 or 5 when we need you. No, dad needs to be, dad can be and dad can do so much in so many ways in that bonding experience. So we were just pleasantly surprised and delighted that, look, these dads show up. And that becomes part of our data. Because even in the 321 women that have been born in this, babies born in this cohort, what about 230 something dads showed up? I mean, these are dads that, not 231 cumulative, these are, mutually exclusive experiences where these fathers show up.
Yeah.
And that's powerful.
That's powerful for other women to see.
Consistently showing up.
It is. And I bet some women will invite the baby's dad when they see other women have, you don't have to have a woman as your, sole support system or your primary support system. You can have the baby's dad.
Yeah.
That's fine, So it's pretty cool.
And we have our breastfeeding rate is higher in Win Network than it is throughout the system for women of the same demographic. And so we like to give that credit to the support that they receive from the CHWs, but also we've said that when you have a family dynamic where there's somebody else who can help you and empower you to breastfeed when things aren't necessarily going the way that you thought they would go. Once you get home in the hospital, you got a nurse there, you got a consultant, you got all these people coming in, Mom, let me help you with the baby, and then we get home, it's just you, baby, and Dad. But if Dad has been properly educated on, okay, babe, you feel engorged, he knows the vocabulary, he knows technique, he knows who to call if something goes wrong, he can absolutely contribute to moms being able to breastfeed I was able to breastfeed for 13 months because my husband was knowledgeable about breastfeeding, and because at times he would say, make sure you're pumping, because if you ever need to get away, I can feed the baby. So that's
right.
Those are things that
that's sweet.
Yeah, the type of support that you need to sometimes prevent postpartum depression. You know what I mean? So we talk about maternal mortality, knowing signs and symptoms when something isn't right, when bleeding isn't right. Like those are all things that your support partner / dad can help with to make sure that mom and baby survive and thrive for that first year.
Gotcha. And there was a page on your website dedicated to young women. I wanted to ask you guys about your experience with young women and why you thought that was important enough to make that like a main thing on your webpage?
Well, I'll start off. Certainly, we call it fabulous, young, and inspired.
Yeah.
This is pre-COVID, so memory is coming back. But we know too, the science, the data show that when moms are, or women are healthy prior to pregnancy, the likelihood of them having a more successful outcome for that pregnancy is greater. So if blood pressure is controlled, if weight is controlled, and that, so wanting to reach out to women of reproductive age, knowing that the likelihood of them becoming pregnant is great, let's ensure that your body is in the best shape, that you're as healthy as possible, because then we don't have to worry about what we call preeclampsia, eclampsia, when there's high blood pressure and seizures, and can result in a bad outcome for mom in terms of maternal mortality, if women are healthy at the onset. So that's why reaching out to them early on is important, even before they're thinking about even, having a baby, that they are at their best health possible. Because we know pregnancy, you're gonna gain weight, you're gonna, things are gonna change, but if you're at your, your healthiest prior to pregnancy, then the likelihood of having a successful pregnancy is increased.
Yeah. That's really important, especially when you're talking about a city with a lot of corner stores, a lot of unhealthy resources. I think it was, and this is not a diss on Tahitian Treat, because I do like Tahitian Treat, but one day I decided to read the back of Tahitian Treat, and I was like, oh my goodness, Tahitian Treat is not a treat at all. Tahitian Treat is trying to kill us. But yeah, I think that's really important. And your organization seems like it prioritizes a lot of patient populations that are typically not prioritized. And in the context of America as a whole, oftentimes I think that Black people and Black women are not typically made a priority, even in the homes sometimes. And so I wanted to ask you how you see your patients respond, a demographic that's typically not prioritized, to your respectful care, to your making them a priority, to your caring about them in the way that you do. So yeah.
Sure. I just want to make a few comments and have Courtney respond to that. But I think, and Courtney even mentioned the unconscious bias training and that sort of thing, the historical perspective around women, especially in OB settings, has not been very favorable for Black women. I mean, they were part of experimentation. The skin, it was felt that Black individuals' skin was thicker, so they don't feel as much pain.
The skin is thicker, wow.
Yeah, that's
exactly. So they don't receive as much anesthesia, that they don't know that much about their bodies, so just discount what they, so even there was a study with medical students that some of these, myths are perpetuated, and still, maybe in the last 10 years, medical students were believing this. And sometimes those myths are not dispelled even in a medical setting. So you come into an experience with a mom with a mindset that's very it's incorrect, but it's also inappropriate. So, but it came from somewhere, and it came from those historical places where, there was experimentation. There were women were given were sterilized with them not knowing they were being sterilized. The Mississippi appendectomy, they call it. So there's a lot of history that people don't know about. I'm talking about Black, white. People don't know about that history, but that history translates into some of the behaviors and that we see today. So that's why it's so important for us to ensure that these women feel affirmed and valued. And I'll turn it over to Courtney to say, what we kind of do with the community health workers and that sort of thing, and to help them feel they are, not 2/3 of a human, because they weren't even considered a full human. They are a full valued person, and especially if you're carrying human life or have the ability to carry human life, that's huge. And we try to get away from a lot of judgment. If you're a pregnant mom, whether you're married or not, or that is, we want you to have a healthy, safe pregnancy. We want you to birth space appropriately and know your body, and just be healthy, not only physically, but healthy emotionally. And I know many of the community health workers help to put them on a career track. They want to go into nursing, or just help the whole woman, this holistic approach, and that they're valuable.
Yeah, here at Win Network, we're very intentional about the community health workers and the people that we hire. Very intentional about their experience as a community health worker. The definition is a lay person who is a part of the community that they serve, or have a close connection to the community that they serve. So very intentional about making sure that we have women of color serving our patients, mothers serving our patients. We have a CHW who had a CHW when she was pregnant. And so these are women that live in the communities that they serve. They know the resources that they serve. They're a part of these community organizations that they're referring, and they actually care. Like our CHWs have gone above and beyond to help. They're not just on the clock from 9 to 5 and then go home. I have to tell them, listen, set boundaries. That's a part of my job is, listen, I know you want to help. I know you want to help. I love you for that. But you have to set boundaries. You cannot burn yourself out. And setting boundaries doesn't mean we can't help. But that's the type of people that we hire. The type of people I have to tell to go on vacation. The type of people I have to tell don't answer your phone after 7:30. And it's okay to give your moms office hours, or tell them don't call me after 7:30 or I'll get back with you. It's okay to wait 24 hours to check your email if you're overwhelmed. But that's the type of community that we have serving our own communities. I'm a part of the community that I serve. I feel very connected to the women that come through this door to have group prenatal care. And I'm intentional about when I meet them, letting them know that it doesn't matter what my badge says or what position I'm in here at Henry Ford. I'm just like you. I get it. I had a baby just like you, and as far as maternal mortality goes, it doesn't matter how many degrees I have. It doesn't discriminate. I'm actually more likely to die giving birth to a child than a white woman who has only a high school diploma. And so it's very important to me to make sure that as a part of the leadership team that I connect with the women and let them know that not only are the people that are here with you every day working for you, we are behind the scenes working for you as well. You don't have to feel intimidated or disconnected. If you need to call me, you can. If you need to call one of them, you can. But those are the type of people that here. You see Dr. Wisdom, this is our leadership, and so we learn from her, and we get the okay from her, and we get she's such an advocate for this work and for these women that she does whatever she can, talk to whoever she needs to talk to in whatever room, to make sure that we have the funding that we need, to make sure that we have the recognition that we need, to make sure that we have the support that we need to continue supporting these women. And so from the top down, we just have an extremely supportive group of people working on behalf of our community. And it's absolutely amazing, and I think that the women can recognize it.
Yeah, and I can even attest to that, because I was telling Miss Courtney before you got here, I wasn't expecting a response back, especially as a college student. Like, this is a project that I'm doing. I'm going to email this organization affiliated with Henry Ford, where they probably get millions of emails a day if they'll do something for a 20-year-old college student. And you guys responded, I think, within the day, if not the next day, and said that the founder was going to be there. And then I was like, wow. And then when I read your rap sheet, when I looked you up on Google, I was really like, wow. And then when I met you and you were nice with that rap sheet, I was really like, wow. So you can tell that you guys really care about the work that you do, and that you see yourself in the people that you care for, and that what you said, I'm just like you. That you would be willing to do this, or even the work that you're doing, you have to be a person like that.
And
the nature of the work is.
Also can relate to you as a young person trying to get things done. It's extremely important that we recognize that this is the work that you're doing, because this is going to add to our mission, right? And it's also going to add to you possibly being able to choose what you want to do and where you want to go in this space. And so anytime that we can support young people that want to do this type of work, and want to learn about this type of work and get the word out there, we will.
Yeah, I appreciate that. I wanted to end with asking you a question about a quote. I don't want to misquote you. So I'm going to read it. Making sure women are empowered and feel strong and feel capable of changing your community because you can. Why do you feel that women don't feel capable of changing their community?
Well, I want them to feel empowered is a really key word there, because empowerment I think about as having the knowledge, the skills, and the resources where possible to change not only their health and well-being, but also to change the community. So actually, if you look at the WIN logo, when we did focus groups with the women, they actually, in many respects, told us that they felt like they were keepers of the community, that they didn't quite feel like they could change it, but they were keepers of the community belonged to them. And that's why we put that cityscape of Detroit in the woman's belly.
Oh, wow.
Because she's a keeper of the community. So we want her to also feel empowered. Not only are you a keeper of the community, but you can transform the community. For one, by having a healthy pregnancy. By two, spreading the word to others about how to have a healthy pregnancy. And then as you get on your feet and your children are at an age, maybe you can come back and contribute to this effort, because it's called WIN Network Detroit. It's a network. It's a sisterhood. And you never graduate out of it, you never leave out of it, even after you have your baby. And I'm sure the community health workers are following some of these women long after that 1 year that they're supposed to follow the woman. They've developed relationships. And we think about it as building the community from the inside out. So having them feel empowered and valued. So the experience is just not about having a healthy baby and a healthy mom. The experience is about how we can transform. I mean, that's core to this work. If you are a different person, not just because of the baby, but you're a different person having left that pregnancy experience than you were when you entered it, we've done a good part of our job. Because we want you to go forward, whether you have any more children or not, but to feel like you have value and you can go forward because the WIN folks said so, and I believe them. And their actions indicated that I had value, because they pick up the phone, they respond. And then to hear that even the impact that you may have experienced, just thinking that we do try to respond to the millions of requests that we get. We're waiting for the few others to know, but because this is community and you're part of the community. So it's like, we still want to be as responsive as possible, because you can help share our message and maybe recruit some more people, but then hopefully you'll have an experience that you'll say, wow, I see things a little differently maybe now. Or I see things at a deeper level, or I see the impact that an idea can have, even with competing organizations, an idea, and how bringing a great team of people together, you can truly begin to move into that transformation space. And I think that's ultimately where we're striving to be.
Wow, that was a beautiful response. Yeah, that's so important that we're all a piece again of a building community that should be striving for greater, and that is striving for greater. And even with you all doing this work, what you said about fathers and young women, people want change. People want their communities to be better. And I think a lot of times, sometimes the news portrays this idea that, Black people are just living in these communities where people are getting shot all day and there's nothing positive and we're all just chilling.
That's right.
Woo, life sucks. We're chilling. Nobody want to change. But that's actually not the truth.
Not the truth.
And people want change. People want better. Even people, whatever situation you're in, whether you consider it good, bad, mild, whatever sauce flavor you consider it to be, people still want it to get better, and people still want to do better, and especially somebody who's bringing life into the world.
Absolutely.
We're typically talking about somebody who, it takes guts to carry another life that is going to represent you when you're not here, most likely. And you're going to cultivate this being and teach them, and so it's so important how we view these women, because having a child, even though it happens every day, it's not an everyday thing, if you get what I'm saying. It's a really big thing. So I think that's really beautiful about what you're saying about community and how people want to change their community and how labor is so important in the concept of changing the community. So
I just want to add one other thing to your point that you made me think of, is that we had an intern 10 years ago. And well, the information's been embargoed. You'll hear about the press release any moment. But this intern 10 years ago spent time with Courtney J, the team, and was so impressed that here now she's working for a foundation, and wanted us to apply for funding through her foundation, and we were successfully funded a pretty large sum of money.
congratulations.
Yeah. So it just shows that we were trying to help people get through their educational programs and that sort of thing by spending internship time with us, having no idea that we would influence somebody that could turn around 10 years later. So we're looking for you 10 years. You got 10 years. Okay? So when you become very famous and that, don't forget about us.
Thank you. I won't.
Come back and say, remember we did that interview way back when? Well, here's
We'll give you some money.
That's right.
Yeah,
but, you know, we had no idea, but we were just trying to build community in every possible way we could think of.
Yeah, well, you know, the Bible says your gift makes room for you. And so the gift that you're giving definitely made room for you, and that aspect for a gift to be given. I feel like I'm using the word gift way too much, but it's fitting in what I'm saying. Yeah. Win Network, I feel like I won. So thank you so much.
You're very welcome.
Thank you.